This special test is also for the shoulder joints, called the Scapulo Humeral test. There's various ways to explore this test, so we're going to have a look at two different options of how to perform it. But essentially it's looking at and identifying the rhythm of the scapula. As the humerus abducts, so comes outwards, you'll get this lateral rotation going on of the scapula to permit abduction of that humerus here. So for every 2 degrees that we abduct, we get 1 degree of rotation here. So they are synonymous. Those two joints, the girdle and the humeral joint, should work in together. So what we're looking for is any dysfunction in that movement pattern. Hence the test being called Scapulo Humeral rhythm. So it's the rhythm of those two joints together. The first way we're going to do it is you're going to locate the scapulas on your client, and then from there you're just going to place hands gently on them. Now what I do is I find the inferior angles and I put the palm of my hand in there, so they're fairly equal. So you're placing your hands over the scapula. Then what you're going to ask your client to do, keeping the palms facing them, is abduct. So if you can just very slowly abduct your arms for me, please. So you're feeling, but also looking and watching your hands to see, and come back down again, if one perhaps is rotating more than the other, or before the other one. Perhaps one is rotating more, which is a compensatory movement pattern, meaning there is probably an injury to that side, and muscles have compensated to put the joint into a pain-free position. You can also look on that test for potential winging of the scapula. So the winging will be seen down here at the inferior angle. Winging normally means a weak serratus anterior, weakness through rhomboids, and a very possible and probable tightness through the pec minor, bringing the girdle into a protracted position, which will encourage the inferior angle to wing. So have a look for winging as well. You might notice as they abduct that they get a lot of protrusion of that scapula as it comes out when the arm is being abducted. Another way to look at this test is for hypertonicity or overactivity of the upper trapezius and levator scapulae. So what you're going to do is you're going to place your hands just gently over the upper traps here, like that. Then what you're going to ask your client to do again is abduct. And you're feeling to see if the upper trapezius are contracting before they should. You should get you should get activation rather, just about 70 degrees. So around about there, these should be firing up to then elevate the girdle to allow for the abduction of the humeral joint. But what you're feeling for is, are they contracting straight away? As soon as abduction is initiated, are they firing up? So just do that for me here, please, Hannah. So out to the side, the arms go, and you're feeling for that contraction of the upper traps. Just turn the face that way for me, just from a side point, and again just abduct and lower down. So just feel perhaps one side is contracting before the other one as well. So the Scapulo Humeral test, two ways to have a look at it, but both equally as important as each other.